Today, let's talk about some survival guidelines to live with microbes and how to keep a moderate, clean environment of microbes. To avoid infection by virus or bacteria besides treating disease with antimicrobial agent, it's essential to have all the essential vaccines, washing hands frequently, and maintaining good hygiene conditions at home, school, and workplaces. Improved westernized sanitation and living conditions, widely applied sterilization, formula feeding infants, all of which are widely practiced in developed countries, and most of us have already developed very strict personal cleanliness habits. We seem to be doomed to win the rock, paper, and scissors game with bacteria. However, individual to metabolic disease, just as improved hygiene was shown to increase the susceptibility to allergic and autoimmune disease and other chronic inflammatory disorders like obesity and diabetes. These various disorders have one other thing in common. Their increasing incidence are occurred almost exclusively in developed and rapidly developing countries. Yet, not all microbes are bad. Some of them can defend ourselves and participate in the metabolism, and most of them can activate the immune system. In 1989, David Scrum, an epidemiologist, discovered that infants born into households with many siblings were less susceptible to eczema. He proposed that early childhood infection protect against allergic diseases. Like in the case of food allergies, what is potentially effective in preventing some specific allergies to food components is to introduce peanuts, eggs, or milk in their food. On the basis of hygiene hypothesis, old-friend hypothesis was built. It suggests that early and regular exposure to harmless microorganisms train the immune system to react appropriately to threats. A key aspect of this approach is that it maximizes protection against pathogens and infection, but it's more relaxed about visible cleanliness in order to sustain normal exposure. Then how can we avoid disease from bad bacteria while still fostering the good bacteria? We certainly wouldn't advocate skipping the essentials such as washing our hands with soaps, but we should be careful when preparing food or using antibiotics. We should contact with microbiodiversity with environment like living with pets. Receiving immunization like seasonal flu vaccine can release the condition of asthma. Applying natural childbirth and breastfeeding is essential to establish immune system for newborn. In political level, providing green spaces in urban area is an useful strategy to increase exposure to diverse microbes.